Today, we're talking about opening up that right side. So we're gonna go through a series of exercises here. Each one will have a different video. And basically we want to work at decompressing the right side tissue. So we're talking about anything from that right side hip all the way up to the oblique, the QL, the abdominals, and then the rib cage. So we're gonna try to really open up this right rib cage to get that shoulder to be able to open back up. So we're going to go through 3 shoulder stretch exercises. Now these aren't necessarily about pulling the shoulder back or retracting the scapula. What we're actually trying to do is we're actually trying to position the arm and the shoulder head and scapula in such a way that it is locked in place, and we're actually trying to open the rib cage up. So this is a very small movement. You're looking at feeling the sensation of stretch more through the pectoral tissue here, and then maybe even through the lateral aspect of the ribs here, as well as through the serratus down in here. Now, we're gonna start by going with a long arm. So you're gonna find a doorway, and you're gonna position the palm of your hand against the edge of the doorway. You're gonna stand, so if you were looking down, you're gonna be able to look down your arm this way. You're gonna take a couple of small steps forward. So really just inching forward just enough to apply a little bit of stretch here. Now, even when I did that, my shoulder started to kind of like fall forward because my body was resisting the stretch. So I'm gonna take a half a step back. I'm gonna roll my shoulder back, which means pulling my elbow forward. So I'm not retracting to roll my shoulder back. I'm just externally rotating my shoulder head and by pulling my elbow forward to align the shoulder in a more posterior type position. Okay, so even here, I can feel a stretch coming across here. It's not huge, but it is a stretch, and that's what we're looking for. We want a minimal amount of sensation that we're gonna gradually build into. Okay, so I've got stretch here and a little bit of tension down the rest of my arm there. Once again, I am holding my elbow forward. It's that external rotation of the shoulder. Now, I'm gonna side bend away from that and then twist to the left just a little bit. So I'm actually gonna kind of start to look to the left to help that rotation happen. Now, as I do this, that stretch gets a lot bigger. Now, it's not intense, it's not insane. It's just the sensation of stretching tissue, maybe a little bit of nerve, pain, maybe just like a little bit down the arm where it's like, that's a little tender, like because you're compressing on the nerve bundle that comes out of the cervical spine and translates down the arm to innervate everything. So we're just looking for that. So a little bit of rotation and maybe even just a hair of a lean forward. So I'm looking left, I'm maybe just ever so slightly shifting my weight forward into my arm, and now I got a good stretch going on that side. Now I'm gonna hold this for 5 good deep breaths. And where I want you to breathe is I want you to breathe into that right side. So go all the way down to the belly, up into those ribs, all the way up to that clavicle point where you're pushing against that space with the breath. Okay, so I'm gonna look left, I'm gonna get my little rotation here, I'm gonna side bend just a little bit into the left and maybe even flex forward just a bit, keeping this in position. I don't want it to follow, I want it to stay back and up because we're trying to open up these ribs here just a little bit and down. So I'm here looking, taking breaths. So big breath in, nice and slow through the nose, thinking about coming in through the back of the throat. Looking left, exhaling, feeling that nice stretch. And every time I exhale, I'm actively pulling my ribs down, engaging my abdominals, obliques, and QL, and I'm feeling that tissue stretch and pull on that exhale. Feeling everything expand on the inhale, really pushing that breath into the sensation of stretch. And exhaling. All the way out. feeling all this engage as I exhale. And then capturing that space right there, hanging out for just a couple normal breaths. And then on a breath in, slowly coming back out of that position, gently letting the arm come down and letting it just hang in this position, keeping the palm open, and try to just relax that elbow out and let it go. Okay. You can kind of shake it out if you want. If that felt a little intense, you can always just kind of like hunch over a little bit and then just let the arm kind of hang here, let it shake, do whatever it needs to do to just be in a space for a little bit and let the body and brain figure out what just happened. So that's position 1.